some stuff here. All right, so we want size-wise. Okay, that looks good.
You can also say your marketing director wife had a rough day, and if there's anyone
you just told them.
Any
marketing you just told them.
agency clients, I'd be happy to entertain them.
Yeah. All right. All right, it is 9:29. We got a minute until the official start of this. So we're doing 60 questions, NCLEX style questions, mixed sets, mixed subjects. So if you were in here last time, we had over 500 people. We had over 500 people in here in the live on Tuesday. So if you haven't already, go ahead and share the live. All right, we're gonna go up with this a little bit. All right. All right. Boom. Okay. So we got a few people coming in. All right, it is 9:30. Let's kick this off, guys. 60 NCLEX questions going on right now. All right, drop your answers in the chat. I'm seeing a couple A's. If you haven't already, go ahead and follow up here as well if you're joining and you haven't followed already. All right, we're doing these a couple times a week. All right, so yes, the answer here is going to be A, increase the head of the bed. All right, so elevating the head of the bed will immediately improve lung expansion and gas exchange, and it's that simple first intervention here in this question. All right, so bear with me real quick so that I can, all right, there we go. Question 2. All right. What are we thinking here? Client prescribed furosemide. Which lab value is most important to monitor? All right, seeing lots of B's in the chat. B's in the chat. All right, awesome. Yep, potassium. Because why? Because furosemide is not a potassium-sparing diuretic. So we need to monitor that. These first 10, I forgot to mention, these first 10 should be pretty easy. They're warm up, pretty easy recall questions, at least I felt. So let's go. All right, number 3. Let's see. All right, there's an A, couple A's. All right, anybody else? Good. All right, yep. Guys, we're gonna push through these first 10 pretty quick. So yeah, A, that weight gain of 4 pounds in 2 days indicates fluid retention, right? Worsening heart failure, and that needs to be reported promptly. All right, so number 4 here. There we go. All right, guys, and if you haven't already, go ahead and share this live. Let's get that number. We had 500 on Tuesday. And if you haven't already, go ahead and follow. All right, question 4. We're seeing some C's, a couple B's. All right, client receiving morphine IV for post-op pain becomes difficult to arouse, has respiratory rate of 8. All right, I see we might need to come back, or I'll do a video on this one, but the answer here is actually going to be C, okay? So the client does have signs of opioid overdose with respiratory depression, and that Narcan is going to obviously reverse that, and that is the priority, is with this NCLEX style question, I can see how B could possibly definitely be on people's minds. The correct answer is going to be C. All right, question. I can't see what number that is after. Okay, 5. Can you guys see that? I see some banners going across. with these gifts or the, I'll bring it down a smidge. All right, question 5. Tima, what? Everybody give a dub to Tima in the chat. She just passed her NCLEX, guys, and she is in here. She watches every single video I post. Give Tima some love in the chat, guys. So proud of you. That is awesome. Fantastic news. So proud of you. Oh, that gives me goosebumps. All right, so question 5 here, guys. All right, so answer here is going to be B. All right, rationale being fast-acting carb-like juice is appropriate treatment for mild hypoglycemia. Okay, so all right, well, let's just again keep moving through these first 10. That's 5. All right, 6. Here we go. All right, we're at 100 in the live. Go ahead and follow, share if you haven't already. All right, guys, thanks for the follows. All right, we see some B's here. Anybody else? All right, COPD question. All right, yep, guys, definitely going to be B. And SpO2 at 94% is adequate oxygenation, okay, with this therapy. Good job. Good job. All right. 7. Here we go. Which statement requires further teaching? All right. Gavin says C. Jennifer says C. Chastity says C. Tyler. Let's go. C's get degrees. Okay, so yeah, the answer is going to be C here, guys. Why? Because green leafy vegetables are high in vitamin K, which can decrease the effectiveness of warfarin. All right, nursing school 101. All right, what was that? That was 7. 8. Here we go. Question 8. A nurse is caring for a client immediately after a thyroidectomy. Which assessment finding is the priority? Let's go. Let's go. All right. B, D, A, B. Oh, all over the place. Gavin with a B. M. Felicia with a B. Jen, Sharif, A. Okay. Which assessment finding is the priority? It's got to be an airway, breathing, circulation issue, right? It's going to be B. Okay. Difficulty swallowing may indicate swelling, hematoma, airway obstruction, and is the most urgent issue of this group. Okay. Moving. Oh, that was 7. That's 8, 9. Okay. Nurse is caring for a client on contact precautions for Clostridium difficile. Which action is most important to prevent transmission? All right. Yep. Great, guys. C, we're going to wash hands in soap after removing gloves because C. diff is what? C. diff is spores, okay? Spores. And it's not going to be killed by hand sanitizer. Okay, is this LPN? Is this RN? These are, this stuff, it's going to be a mix. It's going to apply, a lot of these are going to apply to LPN, but it's mainly an RN deck of questions per se. So, but these, fundamental questions are all going to be applied to the LPN. All right. So, all right. Where were we? 9. Let's do 10. After 10, I'll take 30 seconds after every 10th question. All right. Just to give you guys a little rundown for the new people that have joined. There's 175 of us. Fantastic. Let's go. What's the answer, guys? 10. All right. All right, lovely. Yep, guys, seeing a lot of D's, saying that is the correct answer here, okay? So who do you see first? It's going to be that guy, because what are they showing signs of? That pink frothy sputum is going to suggest pulmonary edema, which is life-threatening and requires immediate assessment and intervention. Fan-freaking-tastic. All right, I'm going to drop this down for a quick sec, and we'll get back to it. So 208 people in here. Fantastic, guys. If you haven't already, go ahead and follow. We're going to be doing this at least twice a week. So if you're studying for the NCLEX, please do. Go ahead and hold the screen. All 218 of you, just hold that screen and tap. Give me 5 or 10 taps in a row. Let's get these likes up so this gets into the next group's lives. All right, and then also just share. 2 other things, the link in my bio. I also do NCLEX study plans custom to you, your time, your resources, your weaknesses. If you're a repeat test taker, it's based on your CPR that you get. That's in the link in my bio. Is also a 250-page NCLEX vault. All I ask for is your email address, which you give to everybody anyway. That thing is totally free. It's got cheat sheets on every subject, mini tests on every subject, and a strategy guide for the NCLEX. All right, back to it. All right, so that was question 10, 11. Here we go, guys. Drop your answers in the chat. All right, this is when the questions, they're not super easy. Maybe they might be easy to you if you've been studying. Let's go. Question 11. I'm seeing some B's and some C's. Client suspected myasthenia crisis. Which assessment finding is a priority? All right. So, correct answer here is going to be B, dysphagia and weak cough, okay? Because that indicates that there's bulbar muscle involvement and is a higher risk for respiratory failure, which is the priority, okay? So airway, breathing, circulation. This is a breathing issue, all right? All right, let's go question 12. It's that one, right? Yep, okay. Let's go question 12. Patient with increased ICP, which order should the nurse question? All right, lots of C's. All right, fantastic, guys. Yeah, the answer here is going to be C. All right, why? Because asking a client to do forceful coughing can increase the intracranial pressure, which should be avoided. All right. A, elevating the head of the bed helps decrease ICP. B, stool softeners prevent straining, which can also increase ICP. And D, neutral neck alignment promotes venous drainage from the brain. All right. So question 13. Here we go. Client with suspected PE suddenly becomes anxious, reports chest pain, has a respiratory rate of 28. Which is the nurse's priority action? Which is going to be the nurse's priority action? 13. Okay, I'm seeing a lot of B's, a couple C's. All right, yeah, guys. So the priority action here is going to be B, place the client in a high Fowler position and apply oxygen, okay? Because why? The client has signs of a pulmonary embolism and impaired gas exchange. So the priority is to optimize oxygenation and positioning, okay? All right, question 14. All right, guys, if you haven't already, go ahead and also share this live. We're at 225. Let's get it going. We've got 45 more questions in this live. Let's go. All right. What is our answer here? All right, I'm seeing a couple C's. All right, great, guys. Good, good, good. We're on question 14. Yep, so the answer here is going to be the client with cellulitis receiving IV antibiotics and stable vitals. All right, so that stable client is predictable, all right, and is most appropriate for that float nurse. All right, 15, 16. Here we go. Question 16. A client with chronic kidney disease has a serum potassium of 6.1 and peak T waves on ECG. What order should the nurse implement first? Okay. I'm seeing C and D. All right. Which order should the nurse implement first? Okay. When you have high potassium, you're at risk for cardiac dysrhythmias. Going into VTAC is the biggest concern. So we are going to put that patient on the monitor first before we do anything because we want to see what that heart rhythm is. Okay. That is the safest first thing to do according to how this question reads with the NCLEX, all right? So you're going to put that patient on the monitor. All right, 15, 16, what did I say? 17. Here we go. Sorry, guys. Lose track of which screenshot to grab. All right, 17. Nurse is caring for a client with a trach which suddenly develops respiratory distress. High pressure alarms on the ventilator. The nurse suspects a mucus plug. What is the priority action? All right, I'm seeing B, C, D, B, D, call respiratory. So think of this as like, okay, if you could only do one thing and then ghost this patient forever, which is going to actually help the patient? Okay, so that the most common cause of a high pressure alarm in a trach patient is going to be a mucus plug. All right, so the one thing that you can do and then ghost this patient forever is going to be B, attempt to suction. Okay, you need to get that mucus plug out to improve ventilation. Somebody said, I had this today. Yep, see, because these questions are happening, right? These questions are out there. They're in textbooks. They're all over the place. Thank you guys for the marshmallow. Thanks for the follow. Thank you guys. I know the chat's moving so fast. Matthew, thanks for sharing the live. Greatly appreciate that. If you guys haven't already, go ahead and follow up here. And please share. We're trying to beat our record of 500 in the live. All right, question 18. You guys are already throwing answers down, wasting no fucking time. You guys are awesome. Yeah. All right. So, yeah, answer here is going to be A, hang a bag of D10 at the same rate as the TPN. Why? Because the TPN is hypertonic. So to prevent hypoglycemia when TPN stops abruptly, that D10W at the same rate is used until the TPN is available. It's a little confusing, but I feel like hopefully that made sense to the majority of you. All right, thanks for liking the live. Michelle, thanks for sharing the live. You guys are freaking awesome. All right, 19. A client receiving chemo reports tingling and numbness in the hands and feet. Which side effect is that most consistent with? What side effect is that most consistent with? Question 19. All right, seeing some B's and some A's. Yeah, guys, the answer here is going to be B, peripheral neuropathy, okay? Because that tingling and numbness in the extremities is classic finding. Chemotherapy-induced peripheral neuropathy. Boom. Shagalaga. John says B, not even a nurse. Awesome. Lauren, thanks for the follow. All right, Just, thanks for the follow. All right. That's 19. There's 20. All right. 20, guys. A nurse is assessing a 2-year-old at a well child visit. Which behavior is expected for this age? Which is expected for this age? Cool. I'm seeing lots of C's. Right. So the expectation for this age is going to be C, engages in parallel play beside other children. Toddlers typically engage in parallel play, right? Playing next to others, but not directly with them. Okay. for A and D, these skills are more appropriate for school-age children. Okay. B, language, kind of 2 years is developing, but not really fully grammatically correct sentences. Okay. All right. 21. Client, pregnant, 38 weeks, gestation, calls clinic, reporting sudden gush, clear fluid from the vagina, followed with continuous trickling. What is the nurse's priority? Instruction. Good old maternity NCLEX question here. All right, I'm seeing C, A, C, C, C. All right. Yep, guys, definitely. All right, so answer here is going to be C. Go to the labor and delivery unit right now, because what are they describing? They're describing rupture of membranes at term. So this patient should be evaluated promptly for labor progression and fetal well-being. All right, fan-freaking-tastic. Oh, you know what? I skipped my after 10 questions. So, hey, for the 100 and some additional of you that are in here now, thanks you for joining. You obviously care about your education. So I'm going to be doing a lot of these. All right, so if you haven't already, go ahead and follow. Okay, then go ahead and share this live so we can get more people in here. Okay, and then a couple other things. So 15 more seconds, I promise. We'll get back to the questions. I do custom study plans for the NCLEX for RN and PN exams. So that link is in my bio. They're $20 just because it takes time to do them and individualize them, because they are tailored to you, your resources, your time, your weaknesses, your CPR if you are retesting. So check that out. And then also in my bio is the NCLEX Vault. All I ask for is your email address, and you give that shit to everybody. So that's totally free. 250 pages of cheat sheets, mini tests, you name it. There's a strategy guide in there. It's been accessed almost 5,000 times since I've created it. Lots of value there. So go check that out. Go ahead, share this live, guys. If you haven't, thank you guys for the follows. All right. So, you guys are now answering. Yep. Okay. I see a bunch of bees in the chat. Bees in the chat. Let's go. All right. 22. Correct. Answer is going to be B here, guys. Tell me exactly what the voices are saying to you, all right? Because the priority here is to assess for suicidal or homicidal content to determine, right, safety and if there's any need for any interventions. Okay. Are there any fundamentals? This is a mixed subject, so there will be some fundamentals in here, and we're doing 60 of them, guys. So we're not even halfway. So, all right, 22. Let's get 23 in here. All right, guys, drop the answer in the chat. Nurse receives report on 4 pediatric clients. Which child should the nurse assess first? Okay. Okay. So yeah, the answer here is going to be B, which I think most of you got, because that drooling in the tripod position can indicate severe airway obstruction, possibly epiglottitis. If you see anything about a child drooling in any of these fucking questions or on your practice exams or anywhere, it's going to be epiglottitis. They love to test it, and it's an emergency and should be treated as such. Okay. 24. Here we go. Client with cirrhosis has new onset confusion, a hand flapping tremor when the arms are extended. Which lab value does the nurse suspect? The elevated. All right. See, we're over 300. Let's go. We're trying to get above 500, guys. Go ahead. If you're new, go ahead and share this live so that we can get more people in here, and go ahead and like that screen in between answering. All right. Yep. 100%, guys. This answer is going to be A, ammonia. Confusion and estrictus in cirrhosis suggests that there is some hepatic encephalopathy going on, and that's commonly associated to, you guessed it, elevated ammonia. Had a patient with this today. I am an ER nurse, and yep, we see a lot of this shit. All right, 25. Okay, here we go. Nurse preparing to administer unit of packed red blood cells. Which action is most important before starting the infusion? I also did this today. Had a patient with a hemoglobin of 3.6. Yep, you guys are right. This is a safety question for sure. So you're going to check that client's identification with another licensed nurse, because two-nurse verification of blood products is critical to prevent fatal transfusion reactions. Good job. 26. All right. Thank you guys for the follows. All right. I can't get to every question in the chat. So if some of you guys are seeing questions thrown in and you happen to know the answer, like, help each other out. Thank you guys for all the follows. All right. So I'm seeing C's, D's, C's, a lot of C's. Okay. Okay. So answer here is going to be D, gently irrigate the catheter with normal saline as prescribed, because these signs, they're suggesting possible catheter blockage by clot. So what we do is gentle manual irrigation as prescribed to help clear that, that obstruction. Okay, 27, boom, let's go. DKA patient being treated with IV fluids and insulin, which indicates that the treatment is effective. This one might be challenging for you guys. All right, I'm seeing lots of C's. All right, I'm gonna have to mark this one. Yeah, the answer here is going to be B. Serum bicarb increases from 10 to 20. All right, so DKA involves metabolic acidosis, right? So improving bicarb levels indicates the correction of the acidosis, okay? So let's stay on this question for a few more seconds. So A, with the potassium often drops with insulin therapy and must be monitored, but that level of 3.1 is too low and risky. Okay, so C, the blood sugar should be lowered gradually, okay, to avoid any cerebral edema, or because that rapid drop is concerning. And then D, increased respiratory rate suggests ongoing acidosis. Okay, I want to spend a little bit more time on this one because a lot of you got it wrong, but that's fine. We're learning, right? All right, 28. Here we go. All right. We have 301 people in the live. Let's go. Thank you guys for showing up. All right, Lisa, you have a med surg exam on Tuesday. Let's go. You're going to crush it. Thanks for joining. Thanks for sharing the live, guys. If you haven't already, go ahead and share this live. Drop a follow up top on the top left. All right, so question 28 here. The answer is going to be B, elevate the residual limb on pillows, because right in that first 24 hours, elevation helps reduce edema and pain. Okay, after that time, prolonged elevation is avoided to prevent contractures. Okay, does that make sense? So A and D, that high Fowler and prolonged sitting can promote hip flexion contractures. And then C, keeping that limb flat without elevation may worsen edema in the immediate post-operative period. Okay, everybody got it? 29. Yep, right there. Okay. We are almost halfway, guys. Almost halfway. We're a little over halfway to our viewer goal. So if you haven't already, go ahead and share this live. All right. All right, I'm seeing lots of C's. All right, which statement indicates a need for further teaching? So yeah, answer here is going to be C. I will stop taking my medication if I feel better to avoid side effects, right? Because glucocorticoids for Addison's disease are lifelong medications, okay? So stopping them abruptly can precipitate an adrenal crisis, okay? All right, question 30. Halfway. Which finding is most concerning? Ooh, are we gonna get it? I see some B's, some A's. Okay, so here, guys, the actual answer here is going to be B, positive Shostak sign. So because that here indicates hypocalcemia, which can lead to laryngeal spasms and airway obstruction. So while I see you guys are thinking hoarse voice when speaking, because that could also allude to some possible airway issues, that Shostak sign is more correct. Okay, I know everybody loves that. Okay, it's more correct because it can cause those laryngeal spasms. All right, thank you guys for all the follows. You guys are freaking amazing. Thank you, thank you, thank you. All right, question. All right, so that was our, okay. So 20 seconds and then we'll jump into question 31. All right, guys, if you're new to the live, go ahead and follow. Lots of NCLEX content on my page, and go ahead and share this live. Our goal is to get over 500 people in here. Then two things, link in my bio. I do custom study plans. I've got a couple to do tonight after this, but I create them for you. They're $20 just because of the time it takes me, and they're based on you, your resources, your CPR if you're a repeat test taker. So chef's kiss. Have had a lot of really good feedback, and people are passing using them. Also in there is my NCLEX Vault, which is free. Just pop in your email and you have access, and 250 pages of cheat sheets. If anybody in here has used a study plan or has used the NCLEX Vault, go ahead and just real brief 1-sentence testimonial in the chat so other people know I'm not full of shit, okay? So go ahead. That being said, go ahead, share the live, follow, like the screen, L330 of you. Let me get just like 10 clicks on the screen. Okay, let's get this live in front of other people. All right, question 31. Enough of the rambling. Here we go. 31, let's go, guys. We're halfway home. Halfway home. Nurse is caring for a client with an epidural catheter for postoperative pain control, which assessment finding is a priority to report. Okay, which is the priority to report? I'm seeing lots of B's, lots of C's. Seems like you guys are split 50-50 between B and C. So here, guys, the answer is going to be C. That client has decreased sensation and movement in both legs. So the rationale here is because excessive motor block can indicate high epidural spread or potential complications, and they must be reported immediately. B, some mild hypotension can occur, but it's less urgent than loss of motor function, okay? That's why. All right, question 32. Here we go. Thank you for sharing the live. Chitaba, thanks for the follow. All right, 32. What do we got? I'm seeing lots of some A's, some D's. All right, here, guys. Yes, So what statement indicates correct understanding of infection control? So the answer is going to be A. I need to wear a mask in public until I have 3 negative sputum cultures. So clients with TB must continue their precautions and usually wear a mask in public until they have 3 negative sputum cultures. Okay. 33. Yeah, give yourself a high five. 33. Which finding requires immediate intervention? I was thinking this one might be trouble for you, but it's not. Obviously, the correct answer is C, as you guys put in there. So that continuous bubbling in the water shield chamber does suggest an air leak that requires investigation. I do have a video on chest tubes. You can go check that on my page after this. All right, 34. Here we go. Nurse is caring for a client with sepsis, receiving a large volume of IV fluids and norepi. Had one of these today too. Busy day in the ER, guys. That's why you should definitely be an ER nurse, because we're the fucking best. Which assessment finding indicates that the treatment is effective? All right, seeing lots of A's. All right, guys, good. Yeah, blood pressure increase to 110/70. That shows improved, indicates better perfusion and response to those fluids and vasopressors. 100%. You guys had no problem with that. All right, 35. Behavioral health nurse deciding which task can be delegated to an experienced, unlicensed assistive personnel. Which task is appropriate? Otherwise, we're talking about a CNA here. Which task is appropriate to delegate to a CNA? When you restate that in your own words. Yep. Okay. Great. Good job, guys. Yep. C. So sitting with a suicidal 1-to-1 for safety obs. All right. I don't think that one requires too much explanation. So 35, 36. All right. Which action is most appropriate when changing the central line dressing? Let's go. 36. Thank you, Rima, Yada, Felicia. Thank you for all the follows. You guys are amazing. You're the reason I'm here. You guys are going to crush this test. 36. Okay. So, the most appropriate action when changing the sterilized dressing, okay, with the answers that we have here is B, use clean gloves for dressing removal and sterile gloves for application. Okay, clean gloves, regular whatever that you pull from the box, are used to remove the old dressing. It doesn't need to be sterile. Okay, sterile technique is used for cleansing and applying a new dressing, or whenever you initiate and do that dressing for the first time. Why not D? Okay, many facilities do instruct the client to turn their head to perform a Valsalva maneuver to reduce air embolism risk. Okay, not just breathe normally. All right. 37. All right. What is the nurse's best action here? Okay, I'm seeing C, B. I'm going to be doing at least twice a week to answer how many times am I going to be doing these questions. And I'll pre-schedule. I know probably about 30 of you actually registered for this live, so that's always an option. It's available in my story. All right. Okay, so yeah, 37. Answer here is going to be C. Document the finding and continue to monitor. So a single blood clot of a golf ball size with firm midline uterus and moderate bleeding can be a normal finding here, okay? Ongoing heavy bleeding, though, or repeated large clots would be concerning, okay? All right, 38. Nurse assessing a client with major depressive disorder says, I just cannot go on any longer. Everyone would be better off without me. What is the priority response? Would you believe I had one of these patients today too? I see it all, man. That's why the ER is fucking awesome. If you're on the fence, you should be an ER nurse because you see everything and you get so much training dealing with all of these different cases. Okay. 38. Yeah. So answer here, I see a lot of D. I see some people trying to do some real therapeutic communication, but you need to, after they say that, you do need to be direct. And so the answer here is going to be A. Priority here is direct assessment, okay, of their suicidal ideation or intent. So you need to determine what that safety risk is. D is empathetic, but does not address the possibility of suicide, okay? So that's why D is incorrect and why A is more correct. 39. Yep, followed by, do they have a plan? Yep. Thank you guys for the follows. 339. If you guys new just go ahead and give me a share on this live so that we can break our record of 500 people in the live, which we got on Tuesday. All right, let's get a big group studying for this test that you all are going to crush. Okay, 39. All right, which finding would cause a nurse to hold the medication? All right, so here, answer is going to be B. All right, heart rate of 56 beats per minute. All right, digoxin's usually held if that apical pulse is less than 60. All right, due to that risk of bradycardia. Okay. All right, so this was 39. We're going to 40. Thank you guys for sharing live. Really appreciate that. If you haven't already, go ahead and do that. If you haven't already, go ahead and just like the screen in between answering questions. More likes, the more this feed is shown to people. Thank you guys so much. All right, so question 40. All right, which prescription should the nurse question? Answer here is definitely going to be C. All right, that polyethylene glycol solution for bowel prep. So bowel preps can worsen diarrhea, dehydration, and electrolyte imbalance in this ulcerative colitis patient, and they are generally avoided. Okay, 41. Here we go. Any advice on remembering electrolyte imbalances? Go check out my NCLEX Vault. I have a whole cheat sheet on electrolytes and imbalances. But we are moving through 60 questions, so I don't have a ton of time to do any ad lib stuff here. Just a little bit. All right, so 41. What assessment finding is priority to report before the procedure? So answer here is going to actually be B, bravo, platelet count of 60,000. So a low platelet count increases their risk of bleeding, right, with a lumbar puncture because they don't have the ability, those platelets decrease the ability to clot if the platelets are low. So A, C, and D, the fever, headache, and photophobia are expected symptoms of meningitis and not contraindications to the procedure, okay? All right, 42. Here we go. And I feel like you guys should be able to see the questions okay. If you're having any issues, just let me know. I think I shrunk it to the appropriate size. All right, 42. Which statement indicates the need for further teaching? Yep. All right. Lots of B's. Fantastic, guys. Yep. So clients on lithium should, maintain adequate fluid intake to prevent lithium toxicity. All right, 43. For those joining, we're going to 60. So jump in the chat, share the live. Oh, I forgot to do my little spiel. Sorry. Go ahead and keep answering. For those of you just joining, I'm an ER nurse. I'm Nurse Jimmy, and I'm going to be doing these a couple times a week. 60 questions, 60 minutes of NCLEX studying. Good for PN, good for RN practice. If you haven't already, go ahead and follow. Share the live so that we can get max people in here. And then in the link in my bio, I do offer custom study plans based on you, your resources, your time available to study, a CPR if you're a repeat test taker, so it focuses on your weaknesses and shoring those up to help you pass this fucking test, okay, because it's hard. And then also there's the NCLEX Vault, which is free, just ask for your email address, and 250 pages of cheat sheets. If you guys have experienced that or have used it in the chat, go ahead and drop a little brief testimonial, just sharing your experience so others who haven't used it know that I'm not full of baloney. Okay. Question 43. Which findings should the nurse report to the provider? Yep. All right. C is definitely going to be the correct answer. Persistent head lag. So by 4 months, infants typically have decreased head lag. Persistent lag could indicate a developmental delay or some sort of like neuromuscular issue. Okay. All right. Question 44. There we go. Okay. What vitamin deficiency is most likely responsible for these symptoms? I see some D's, some B's. Yep. Okay. So yeah, answer here, guys, is going to be B, thiamine. So thiamine deficiency in alcohol disorders can lead to Wernicke's encephalopathy. So they do present with like confusion, ataxia, nystagmus. Okay, A, C, and D, they all have other manifestations. Okay, 45. Client with a history of DVT is scheduled for surgery. Which preoperative order should the nurse question? Thank you guys for the follows. You guys are awesome. All right, I'm seeing C's and B's. An A. All right, so question 45 here. The answer here is going to be D, withhold all anticoagulants for 48 hours post-operatively. All right, so these high-risk patients often receive anticoagulants relatively early after surgery to prevent new DVTs, depending on the bleeding risk. So completely withholding anticoagulants for 48 hours may not be appropriate. Okay, for A and B, holding the warfarin pre-op and then bridging with heparin is pretty common. And then C, the SCDs do help prevent DVTs and are appropriate. Okay, 46. All right, nurse came for a client post-thyroidectomy. Suddenly, the client developed stridor, severe difficulty breathing. What is the priority action? I'm seeing some A's, some C's. Okay. All right, we'll talk briefly about this one. So the answer here is going to be A, call the rapid response and stay with the client. So stridor indicates an acute airway obstruction. We know that. That's first day of nursing school stuff. That is life-threatening. So here, a rapid response and immediate emergency management are required. So elevating the head of the bed and oxygen, not to say they're not helpful, but they should occur in the context of an emergency response. Okay? So it's correct, but A is more correct. All right? Laugh with me, guys. It's funny. All right? It's not C, I promise. It's just the way these questions work. They're here to trick you. Okay? Thank you for LOLing. Thank you. Thank you. I'm here all night, guys. I'm not going to be here all night. For the record, I got to go to bed. 47. Let's go. Oh, that's 49. Jumping ahead. Here we go. 47. Client, type 2. They take metformin daily. Which statement by the nurse is most appropriate? All right, 47. I'm seeing lots of A's. Okay, some B's. All right, guys. Here, the statement by the nurse is going to be B. Okay, we're going to hold your metformin before surgery per protocol because here's why. Metformin is typically held before surgery or procedures with contrast due to the risks of lactic acidosis. Okay, so A and C, taking metformin around surgery is not recommended. D, it does affect perioperative risk, so it cannot be continued as usual. Okay, thank you for the follows. You guys are awesome. 48. My dog is whimpering. Thank you guys for all the follows. Holy shit, you guys are on a follow spree, and I love it. Thank you guys. 48. Which finding requires immediate intervention? I'm seeing lots of B's. I don't want to do it. I don't want to say it. Bees in the trap. Bees in the trap. Oh my God, I'm sorry. It's the last one, I promise. I should stop making answers B. Okay, boom, the answer is B. Bluish discoloration around the umbilicus. Okay, do you remember maternity? This is Cullen sign, okay, like Edward Cullen, like from Twilight, right? Anyway, so this indicates hemorrhagic pancreatitis and internal bleeding. This requires urgent intervention. All right, good old Edward Cullen sign. All right, any Twilight fans out there? Hey, I was a teenager when it came out. Was I? Trying to remember what year that came out. I feel like I was a teenager watching it, maybe in my 20s. Now I will never forget the Cullens. Yes, that's what I'm talking about. That's what I'm talking about. All right, question 49. Client in the emergency department reports sudden severe headache. Worst headache of the life with stiffness, photophobia. What's the priority nursing action? All right, seeing lots of C's. Good. Couple B's. C all day, says Kristen. Yep, answer here is going to be C, guys. Prepare the client for CT of the head. So the rationale being that the description suggests that there's a possible like subarachnoid hemorrhage or other sort of intracranial bleed. So that rapid imaging is going to be priority to diagnose and initiate treatment. Okay, 50. Here we go. 50. Is it that one? Sorry. Sorry. Okay. Nurse caring for client with a history of chronic steroid use. Admitted the vomiting and diarrhea. The client is now hypotensive and tachycardic. Which physician order should the nurse anticipate? Let's see, B, 50. Oh, I know, fuck. You're right, I hit 50, I should stop. I'll stop after this one. Come on, come on, come on, come on. Let's go, let's go. Share this live, guys. Let's go. We're dropping. All right. 50 is going to be B, right? The IV hydrocortisone. The rationale is so clients on chronic steroids can develop into an adrenal crisis during stress or illness and require IV glucocorticoids. All right. What else are you guys saying? B. All right. Yeah. No, it's not B, guys. All right. 51. Oh, no, I'm stopping. Real quick. For those of you that are joining, I'm Jimmy. I'm an ER nurse, and I'm going to help you pass this fucking test. Okay? So to do that, go ahead and follow. Go ahead and share this live. Then a couple additional things. In the link in my bio, I do custom NCLEX study plans tailored to you, your life, your hours that you have available to study. If you're a repeat test taker, it's based on your CPR. You can find that in the link in my bio. They're $20 just because it's the time that it takes me to do it. So after this live's over, go ahead and fill that out. And then also is my NCLEX Vault, 250 pages of cheat sheets, study guides, mini quizzes after each section, a strategy guide to annihilate this fucking test. All it requires is your email address. That's it. All right. Let me move this question back up into place. I think that's a good spot where we were. All right. Question 51. 9 more. 9 more to go. All right, here we go. Nurses planning care. Oh, Bucks traction for a femur fracture. Oh, you guys are all over the place. B, C, D. Holy moly. Okay, a few more B's. Hamdi, I've already submitted my CPR. Fantastic. All right, yep, guys, your answer is going to be B. Keep those weights hanging freely at all times. The rationale is those traction weights must hang freely to maintain effective traction and alignment. Okay? All right, 52. Is that one? Yep. Move that to the side. All right. Which food choice indicates the clients need more teaching? Okay. Yep. Answer here is going to be B. Baked potatoes with skin and orange juice. All right. Potatoes with skin and orange juice are high in potassium, which is restricted in chronic kidney disease. All right. 53. All right, you're about to do IV Vanc. Did this today too. Which assessment finding should cause the nurse to hold the medication and notify the provider? Okay, I see A, B, C, D. Literally, you guys are picking all the answers. Mild flushing to the face. Okay, you guys are thinking red man syndrome. I see where you're going, though we have to know our lab values because here the answer is going to be A. All right. A trough of 22 is above that typical therapeutic range and increases the risk of nephrotoxicity and ototoxicity. All right. Let's talk about C. Okay. That mild flushing, right, may indicate red man syndrome, which is only managed by slowing the infusion. That's the NCLEX answer to address red man syndrome. Okay. It is just the treatment is slowing the infusion. Okay. Not automatically holding the drug. Okay. I knew. Mild is the key word. All right. Fan-freaking-tastic, guys. 54. Okay. Here we go. 34 weeks gestation with blood pressure, proteinuria, hyperreflexia. Which medication does the nurse anticipate administering? Oh, you guys are, let's say a few more. You guys are all over this one. Yep, mag sulfate. All right, so this client has severe preeclampsia, okay? And that mag sulfate's given to do what? Prevent seizures, okay? I don't think I saw any other opposite answers. You guys were all in on mag sulfate. Freaking love it. All right, 55. There we go. Nurse caring for a client with autonomic dysreflexia after a spinal cord injury at T4, which finding requires immediate action. Sorry for shaking the screen. Okay. Yep. Get that BP down, Cherry says. 100%. So answer here, severe hypertension is going to be that hallmark sign of autonomic dysreflexia and can cause stroke. All right. What else did I see? B and C. B and C, these may be present, but not as critical here, okay, as that very high blood pressure. Okay. 56. Here we go. A nurse assessing 4 clients. Which finding is the best example of a potential sentinel event that requires immediate follow-up in the hospital setting? What are we thinking? All right, so here we're talking about an example of a potential sentinel event that requires immediate follow-up. Okay, so yeah, you guys are all over the place. So here actually, so the answer here is going to be C, that client who received the wrong dose of insulin without harm. So let's spend a minute or two on this one. Okay, so a medication error that reached the patient is considered a serious reportable event and requires incident reporting and system evaluation. All right, even if there was no harm. A and B, these values do require adjustments, but they're not sentinel events by themselves. Okay. D, that pressure injury presents on admission is not a hospital-acquired adverse event. All right. A client who receives the wrong dose of insulin, whereas it didn't cause any harm, it was a potential sentinel event. Okay. All right. Enough said. 57. Nurse teaching new parents about safe sleep practices for their newborn. Which statement indicates correct understanding? I feel like this is a layup. That's right. You guys are all going to be great peds nurses, right? You're going to educate your families to make sure those babies sleep on their backs on a firm mattress. Answer C. Okay, because that will decrease their chances of SIDS. Okay, somebody said A. Prone sleeping increases risk of suffocation. We're not going to do that. This is, how do you obtain this question bank? This is a question bank that I created. This is not for the public eyes. I might, what I'm going to do is I want to add more to the NCLEX vault. So I will likely, maybe add a comprehensive test to the end. So you guys will have access to it at some point. But if you want that freaking NCLEX vault, just go to the link in my bio, put in your email, Bada bing, bada boom, it's yours. Okay. And you'll have access to any updates I put in there. All right, 58. Nurse caring for a client who's receiving IV potassium. Over an hour, the client complains of burning at the IV site. If anyone has given IV potassium, you know this answer. Come on. All right. IV potassium burns like fucking fire in your veins, okay? And that's totally expected. Okay, we're not going to stop the infusion and remove the IV, okay? IV potassium hurts normally, okay? So what we're going to do here is we're going to decrease the rate. We're going to decrease the infusion rate, okay? So sure, we'll decrease the infusion rate and assess for phlebitis and infiltration. Okay, we'll do it, right? But stopping and removing is only required if there are signs of infiltration. But you got to assess first. And then, did anybody say C? No. So, I mean, sometimes in the real world, Bree, yeah, you'll see patients have some normal saline running with it, but that's medication too. That bag of normal saline is not in the order set. So if people are doing that, it's kind of a medication error because that's fluid that they're not getting. You want to clear that with your doc first. Hey, patient's really burning at the IV site. Can I hang, a little bit of a 250 bag of fluid to run with it? So you got to make sure that your doc is aware of that and chart that. But NCLEX wise, that's what we're talking about. We're talking about decreasing the infusion rate. All right, 59, almost done. We're going to 60 and we're almost done. All right, nurse teaching client with heart failure about how to monitor for worsening condition at home. Which statement indicates correct understanding? All right. All right. Yep. Lots of A's there. Very good. So if I gain more than 3 pounds in 2 days, I'll call my provider. So that's right. So rapid weight gain is that sign of fluid retention and worsening heart failure that should be reported. Fantastic. And guys, while you're in here, if you wouldn't mind just like in the chat, because I'll review the chat after this, like any input on what you found helpful or valuable, or just say, yeah, I want to do more of these. Just any feedback that you have, put it in the chat here, and I'll review that in the recording later. All right. All right, 60, nurse in a long-term care facility observes a UAP transferring a frail older adult from the bed to the chair without using a gait belt and leaving the bed in a high position with the side wheels down. What is the nurse's most appropriate initial reaction? Nunu, I'm still kind of figuring that out, but I will kind of post a video. I've got some other, life things to schedule around and figure out exactly what would be a good regular cadence to do these lives. But twice a week, it's not recorded to where you can watch unless I I don't know if I could download it and then upload it to YouTube. That could be possible. I don't know. If I do that, I will update you. SATA questions. All right. Open questions works for me. All right. So yeah, 60 here is going to be B, immediately intervene and correct the transfer technique immediately. Okay. Right here, this is a safety question, and safety is the first priority here. And this question is all about safety. So the nurse must step in right away to prevent a fall and demonstrate safe technique. A, C, and D, these, They could be considered afterward, depending on the severity of the issue and facility policy. But that immediate intervention is going to come first. All right. So, yeah, awesome, guys. So if you haven't already, before you dip, go ahead and follow. All right. Thank you, guys. And again, I'm Jimmy. I'm an ER nurse, and I help with NCLEX prep. And in the link in my bio, you'll find custom NCLEX study plans where I create the plan for you based on your study date. So it's a schedule. So and it's based on your resources, your time available. Not, you have different time available on the weekdays versus the weekends. I take that into account. So it's $20 just because it takes me time to do it. All right. And I'm going to be doing 2 after I hang up with you guys. So great. Ella, you're going to crush the fundamentals ATI tomorrow. No doubt. Just focus on safety. All right. Fundamentals is all about safety. Check that out. Check out the NCLEX Vault. Dip in there. All it requires is your email. I promise you, you're going to get value from it. So 250 pages of cheat sheets. Hard to go wrong. It's easy to navigate. So just if you have any questions, I'm pretty available. I try to respond to as many DMs as I can. So yeah, Taurus, you're a repeat test taker. Go to the link in my bio, and I'd be happy to create a custom study plan. Not necessarily, when are you live? It's going to be at least twice a week. And if you follow me, you will get those updates because I'll do a video that day saying that I'm going to be live, and hopefully you'll be able to see that. And also in my story, I'll put that I'm live. But I will get a more of a cadence, so to speak, and I'll put that information out there once I have more information that I can commit to, like say Tuesdays, Thursdays, or whatever the case may be. My daughter plays volleyball, so we've got practices a couple times a week in the evening, so I can't always do that on So I don't have a set day and time, but life is crazy right now. But I will let you guys know. So if you haven't already, go ahead and follow up there. What other you guys have? There's about still 100 of you straggling around. Yep, Sally, you're so welcome. You are very, very welcome. Yeah, so it is the turnaround for the study plans is it's a 24 to 48 hour turnaround for the study plans. So they take a little bit of time, but I'm happy to do it. So you can find those again in the link in my bio. And good, awesome. I'm so glad that this was helpful because I've seen some of the other NCLEX creators, and it's just, I don't know, it's weird. They've got their phone pointed at the TV screen. It looks a little weird, and it's kind of hard to see. It gets fuzzy. Let's do another set of 40 questions to equal 100. I know, right? Well, I've got about an hour to spare because I got home from work at 8, put in a 12-hour shift, shower, eat. I would love to do 100 with you. But I got to take care of myself. I got self-care too. So preferred times, 9:30 is a good time just because it gives me time to get home, get settled, get showered. But I will let you guys know what days moving forward we have that we're going to do lives. It'll be at least twice a week because these I'm feeling they are super valuable. R is like 1 per subject per live. What I might do is like a poll at some point and see what what subjects, we might do, like a maternity or a fundamentals or something like that, or it's a subject specific live. I think that'd be a good idea. I do like these mixed subjects just so you guys get to see everything. But I could definitely see some value. Definitely see some value in doing a subject one. You have a comprehensive final December 10th. Could you make a study plan? So the study plans are for the NCLEX. The way that you're describing it sounds like this is a comprehensive final for nursing school. I don't do study plans for nursing school per se, at least not yet, but for the NCLEX for sure. So when you get there, you know where to find me. Self-care is important. Yes, absolutely. So we had a long, fun day in the ER. It's a level 2 trauma. So my assignment was kind of the serious, the critical rooms. So yeah, my first patient was a hemoglobin of 3.6, bleeding, needing fast blood to gravity. It was action-packed way to start the day. And yeah. But if you guys are thinking of ED, if you guys have questions that are not even NCLEX related, you just want to send me a DM, or better yet, comment on one of my videos, because that helps the video. And I literally try to answer almost every comment. So if you have a question or anything about nursing or about being an ER nurse or anything like that, drop it in a comment. When will you be getting your CPR? I believe you have to, I've already passed and you've gotten your notice that you haven't. I think in some state, I think you have to request it. So go on there and I don't know if it's through Pearson or through the Board of Nursing, but Google it. And all right, so you should receive it soon. If not, I would reach out. And as soon as you get your CPR, come back to me, go to the link in my bio, and we'll get you a study plan to build you back stronger and more confident for this next attempt. No shame in that. I took the NCLEX twice. It happens. All right. We just need to be more prepared with how to use the resources that we have access to, because we are not short on resources, but we do not always have a plan on how best to use those resources. Okay. So that's kind of where the study plan comes in, and it gives you literally a Monday through Sunday schedule of what topics to focus on to bridge those weaknesses, whether they're self-identified weaknesses that you tell me about, or they are weaknesses that are brought up by your CPR. All right. Thank you guys for the follows. If you guys haven't already, if you guys are still open to putting in feedback, you can drop it in. I request a CPR evaluation. Oh, awesome. Hamdi, you may have already, if you may have already done it, I may have yours in my inbox, because I have 2 to do tonight. So I have one that I've already started, and you may be the other one. So awesome. Yeah. Thanks for doing that. We'll get you through this next stage. That's it. You've already done the hardest thing that you've probably ever done in your life, and that's pass nursing school. So that in itself, you should be extremely proud of. So this next part, just you're going to over prepare this next time, and I got you. All right, we're going to get through this. All right, so that's it, guys, for now. The 70 of you that are left, thank you so much. Cheers. Go wind down, go to bed, get some sleep. All right. I appreciate all of you. All right. Until next time, I will let you guys know with as much notice as I can when the next live is. So, all right, guys. See ya. Thanks.